Many people think that fatty liver disease inevitably gets worse over time, but that's not always true. In one study, people who lost more than 10% of their body weight saw resolution of fatty liver inflammation in approximately 90% of cases. While individual results vary, the findings highlight how lifestyle changes can make a real difference. In this video, we'll explain what fatty liver disease is, what causes it, and the dietary changes that may help improve liver health. Number 1, what is fatty liver disease? Fatty liver disease occurs when excess fat accumulates within the liver. It has become one of the most common causes of chronic liver disease worldwide. Number 2, what causes fatty liver disease? According to current clinical guidelines, fatty liver disease is strongly associated with metabolic health conditions. Common risk factors include overweight and obesity, type 2 diabetes, insulin resistance, high cholesterol or triglycerides, high blood pressure, metabolic syndrome. These conditions often occur together and may contribute to fat accumulation within the liver. Number 3, what happens if fatty liver disease is not treated? While fatty liver disease can progress to liver inflammation, fibrosis, and cirrhosis in some people, many individuals will not experience serious liver complications, particularly when risk factors are identified and managed. Current evidence also shows that people with fatty liver disease have an increased risk of cardiovascular disease, including heart attack and stroke. Number 4, what symptoms can fatty liver cause? One important point is that many people with fatty liver disease have no symptoms at all. When symptoms do occur, they may include fatigue, reduced energy levels, a feeling of discomfort or fullness in the upper right side of the abdomen. These symptoms are not specific to fatty liver disease and can occur with many other conditions. As a result, fatty liver disease is often discovered after abnormal liver blood tests or an ultrasound performed for another reason. Number 5, can fatty liver be reversed? One of the encouraging aspects of fatty liver disease is that it can often be reversed, particularly in the earlier stages. In one study, people who lost more than 10% of their body weight saw resolution of fatty liver inflammation in approximately 90% of cases. While individual results vary, the findings highlight how lifestyle changes can make a real difference. Number 6, is there a special fatty liver diet? One of the most common questions people ask is, what is the best diet for fatty liver disease? According to current clinical guidelines, there is no single fatty liver diet. Current guidelines encourage a diet rich in vegetables such as whole fruit is generally preferred over fruit juice because it contains fiber and is usually less concentrated in sugar. Adequate protein intake may help maintain muscle mass, particularly during weight loss. Whole grains may help improve fiber intake and support satiety. Current guidelines support dietary patterns that include healthy fats such as one dietary pattern that is frequently recommended for people with fatty liver disease is the Mediterranean diet. Rather than focusing on a single food, the Mediterranean diet emphasizes vegetables, fruits, legumes, whole grains, nuts, olive oil, and fish. What might a Mediterranean-style day look like? Breakfast with oats, yogurt, coffee. Lunch with salad, chickpeas or beans, olive oil dressing, whole grain bread. Dinner with such grilled salmon, roast vegetables, small serving of brown rice. Foods often recommended to limit: sugar-sweetened beverages, highly processed foods. Alcohol can contribute to fat accumulation within the liver and increase the risk of inflammation and scarring over time. If you have fatty liver disease, reducing or avoiding alcohol may be an important part of management. The amount of alcohol that causes harm varies between individuals, and some people develop liver disease at lower levels than others. Should you follow detox or extreme diets? There are many diets promoted online that claim to detox, cleanse, or rapidly reverse fatty liver disease. Current clinical guidelines generally support sustainable long-term dietary patterns rather than short-term detoxes or highly restrictive diets. Number 7, can exercise help fatty liver? Exercise may help reduce liver fat even before significant weight loss occurs. Current guidelines recommend regular physical activity as part of fatty liver management. Both aerobic exercise, such as walking or cycling, and resistance training may be beneficial. Aim for at least 150 minutes of moderate activity per week. Number 8. What about GLP-1 medications? Lifestyle changes remain the cornerstone of treatment for fatty liver disease. However, some newer medications are showing promise. GLP-1 medications, such as semaglutide and tirzepatide, can produce substantial weight loss and may improve fatty liver disease in some people. Medication suitability varies between individuals and should be discussed with a healthcare professional. If you found this video helpful, you may also want to watch our other videos.